All right, everyone, we're going to get started. Just wanted to say hello and welcome. Thank you for joining us for today's Healthcare Compliance Pros online webinar titled Don't Risk It, the Importance of Security Risk Analysis for ePHI Protection. My name is Josie Henderson. I'll be one of your hosts in today's session, and we're thrilled to have attendees joining us from all across the country as this is a online webinar. I'm sure more will join as we just get started. But at Healthcare Compliance Pros, we are committed to helping healthcare organizations stay secure, compliant, and prepared. Today's session is a key part of that mission as we dive into one of the most vital areas of HIPAA compliance, conducting a proper security risk analysis for protecting ePHI. Now it's my pleasure to introduce our speaker, Jake Yates. Jake is a seasoned healthcare professional with over 15 years of experience in mental health, risk adjustment, healthcare audits, and compliance. As a compliance consultant, he partners with healthcare organizations to navigate the complex landscape of regulatory requirements and ensure compliance. Jake's expertise spans a wide range of compliance areas, including CMS audits, RAPS and EDS claim submissions, healthcare risk management, and regulatory healthcare compliance. His extensive experience working with top U.S. insurance plans has equipped him with a deep understanding of healthcare compliance and Medicare Advantage, HEDIS, and RADV audits. Jake has a proven track record of delivering engaging and informative presentations on healthcare compliance, leadership, and a variety of other topics. He has shared his insights with a diverse audience, including sorry, nationwide healthcare organizations, professional billing groups, medical groups, and private physician practices. By leveraging his deep industry knowledge and strong communication skills, he's empowered company healthcare organizations to achieve compliance excellence and drive positive change within each institution. Jake holds a bachelor's degree in social work from the University of Utah and a Master of Business Administration and Healthcare Management degree from Western Governors University. His professional certifications include Certified Healthcare Compliance Professional, Project Management, and Lean Six Sigma. As I pass the mic over to Jake, please join me in giving him a warm virtual welcome. Thanks, Jake.
Perfect. Thanks, Josie. I'm excited to be here today and to speak on this important topic. So thank you to all of you, of course, for being here to participate with us today. We want you to absolutely make use of the Q&A functionality that you'll see on the bottom or top of your screen, depending on how you have Zoom set up. So we'll make sure we leave some time at the end of the meeting today to answer any questions. We'll leave about 10 minutes or so. If we don't have time to get to all the questions, we'll certainly respond back to you with your questions, answers to your questions via the email you used to register for the webinar. So without further ado, let's get started. So during the next 50-ish minutes or so, we're going to answer kind of 4 primary questions regarding cybersecurity and security risk analyses. First, what even is a security risk analysis? We hear this term thrown around a lot in healthcare. So we're going to dive in so that even those who may be new to this space, or maybe this is your first year conducting an SRA, so that you can understand what the purpose is and what it even is. The next thing we'll look at is why conducting an annual SRA is an important part of your compliance program. We'll dive a little bit into cybersecurity and how an SRA can help you with your cybersecurity. And then finally, we'll talk about how to get started, some best practices, some common questions, things like that, as well as we wrap up our session today. So first, what even is a security risk analysis? So a security risk analysis is really a multifaceted assessment. It's meant to really help you evaluate your digital protection of ePHI. From there, your SRA helps your organization understand and implement things like the HIPAA security rule. and helps you identify any potential gaps when you implement the HIPAA security rule in your organization. And from there, executing on following the HIPAA security rule. Now, an SRA helps you really implement those safeguards that you need to keep patient information safe and continue to protect your own organization from data breaches. So the HIPAA security rule specifically states that conducting a risk analysis is the first step in identifying and implementing safeguards that comply with and carry out the standards and implementation specifications in the security rule, written in very true government fashion. So in essence, it's helping us identify and implement safeguards to protect our sensitive information, especially ePHI. Now, it's important to note with an SRA that it is not a one-size-fits-all assessment. So especially if you're using a free version, which is awesome, the Office of the National Coordinator for Health Information Technology, also known as the ONC, and the Department of Health and Human Services Office of Civil Rights, or the OCR, have developed a free version that's available for you to use. It's a great version to use, and we'll kind of get into the SRA a little bit more, and I have a few kind of tips and tricks for you if you're using the free version. But while the SRA is helpful in making sure that you're following HIPAA security regulations, it's important that you understand the unique way your organization operates, because that will impact your SRA in some ways. Now, I want to talk a little bit about some recent incidents that have happened. So as of June 2025, June 30th, so last month, over 28 million patient records have already been compromised this year through some type of HIPAA incident, typically cyber attacks. So this means that so far this year, 1 in 12 people in the US have had their medical records compromised, which is unreal to think about that statistic. There's 3 kind of primary cases I wanted to highlight. So these are specific organizations that the OCR has already released a settlement on because of a breach of PHI. So the first one is Vision Upright MRA. So they had a breach of their secured picture archiving and communication system, or as many of you would know it as a PACS system or PACS server. And this is where they're storing all of their radiology images. So when the OCR investigated Upright Vision MRI, they had found that they had never actually conducted a HIPAA security risk analysis in the last 16 years. The entire time they've been in business, they have not once conducted an SRA, which is startling in and of itself. But to go that long, and especially not have a breach, is extraordinary in the first place. What the OCR had found is that they had failed to complete timely breach notification. So when they had their breach earlier this year, they did not follow the right of access law and or the HIPAA security law, and let individuals know within the 60-day time frame that their patient data had been breached. They had over 21,000 individuals that were impacted by just their breach. So as a result of that, the OCR fined them $5,000 and directed them to complete a security risk analysis every year, which is a requirement. So they should have been doing it anyway, but told them they have to. And then in addition to that, they are going to have the OCR monitoring them very closely for the next 2 years. So that's just one example of an outcome that can come from not having completed an SRA each year. The second one is Baycare Health System. So the OCR actually started the investigation of Baycare Health System following a complaint back in October of 2018. So this has been ongoing for years now, and they finally just reached settlement. In this case, a patient had alleged that they received treatment at a Baycare facility and then was contacted by an unknown individual who showed photographs of her medical records on a computer screen and a video of them scrolling through her patient information, her chart. Now, after they conducted their investigation, the OCR determined that the credentials that were used to access that record actually belonged to a non-clinical former staff member of one of the Baycare physician practices. Now, as a result of that, there was some corrective action that needed to happen. So in addition to being told they need to conduct an SRA and not having done that in a long time, Baycare now will have the OCR monitoring them closely for 2 years. And they also had to pay a fine of $800,000. So a substantial amount of money for this type of incident. When the OCR investigated this incident further, they also found that they had no policies and procedures regarding access to ePHI. And on top of that, really regularly, didn't review their records and system activity, all things that would be addressed and handled as a part of conducting a thorough security risk assessment. Final one, I promise. I know these get kind of lengthy, but I just want to really illustrate what can happen and what the risk is of not having conducted an SRA. So the final one is Jackson Health System. Now, this has two different pieces to it. Both of these were the result of an insider data breach. So these are individuals who had access to Jackson Health System's data. So the most recent one just occurred at the beginning of last month, June 6th, 2025. Jackson Health System released a statement stating that they had become a victim of an employee who took advantage of their position in their organization and started accessing the EMR and obtained all kinds of information, names, birth dates, addresses, medical record numbers, clinic information, things like that. And that individual took over 2,500 patients' data over the course of a 5-year time period, and then used that data to promote their own personal healthcare business. Now, it shouldn't be any surprise that that individual was terminated, but the violation still occurred, and Jackson Health System is still sorting through that and looking at some of the things that they can do to rectify that situation, including some criminal HIPAA violations against that employee. Now, the thing that was really startling to me about this as I started digging into Jackson Health System a little bit more is 5 years prior to this incident, so 10 years, starting 10 years ago, they had an almost identical incident that happened. An employee stole almost 24,000 patient records and went undetected for over 5 years. To me, that the type of things that are happening, especially in this organization, really give you a great idea of the importance of having specifics in place to protect your organization. So an SRA would have easily caught these things for Jackson Health System and would have made it would have resulted in significantly better outcomes altogether. So although a final settlement has not been formally announced by the OCR against Jackson Health System's most recent breach, you can bet that they're going to be monitored by the OCR for 2 years. They'll pay a fine, and they're going to be told to complete a security risk analysis. So this is, I promise this is not a, giddy compliance officer here just saying complete a security risk analysis because it's fun. I get that compliance is not the funnest thing for most people, but this really does matter, and it really is an important thing to do to protect your organization. So next, let's look at the whys of an SRA, and let's talk about that a little bit. Why is an SRA important? Well, it shouldn't come as a surprise to anyone in the healthcare field that ransomware and phishing incidents in the industry continue to rise. Even outside of work, we are constantly bombarded with phishing emails in our personal inboxes, text messages stating that we owe money for tolls or we're going to be sent to jail. And you know the kind I'm talking about. We've all received at least one of them at some point. Now, to give you kind of an idea of the impact some of these phishing and ransomware attacks are having on the industry, let's talk a little bit about patient record compromise as a result of ransomware and phishing incidents. So kind of like I mentioned in the beginning, with about 28 million people being impacted just this year alone, in 2023, for the entire year, there were 36.8 million patient charts compromised. So we're almost to that point already just by the end of June. And it's very likely we're going to end up exceeding the 2023 statistic. Now, last year was a little bit of a different story when it comes for a compliance side of things, because as many of us were impacted by the Change Healthcare breach, that was still one of the most significant breaches in United States history as far as patient data being concerned. The final numbers when they came in was 256.8 million patient charts compromised. That includes majority of those being the Change Healthcare breach, but also any other breaches exceeding 500 patient charts that were compromised. To put that in perspective, the United States has approximately 340 million people. So 256 out of 340 million people were impacted by a cyber attack last year. Their records were in some way compromised. So that means that 3 out of every 4 people were impacted by some type of a medical record breach, from ransomware, a phishing attack, things like that last year. So the SRA really plays a key role in knowing where your risk areas are and avoiding those risk areas when it comes to ransomware, phishing, and many other areas. So the SRA is really a tool to help you understand where those risks are. All right, so kind of like we talked about in the beginning, there are civil monetary penalties for noncompliance. Some of these penalties can be very significant, especially if little has been done to protect patient information. So at this point in the year, or as of the end of June, the OCR has issued $3.6 million in civil monetary penalties up to the end of June. Now, that's only for 9 organizations that the OCR has finished investigations with. So, like you can see on the pie chart here, the fines can be quite steep. The cost of the fines far outweigh the cost of even hiring a vendor to help with your security risk analysis. So when we talk about prevention, an SRA is a great way to prevent incurring additional expenses that would come from fines if a violation were to happen in your organization. Next, let's talk a little bit about how this can impact patients. So for kicks, giggles, and grins, let's consider this for a minute. What do you think would happen right now if your organization had a HIPAA breach? How do you think your patients would respond to that? Would they be forgiving? Do you think they'd still trust your organization? Would they be concerned about how seriously they feel you treat their PHI? On the flip side, kind of putting ourselves in the patient's shoes, how would you feel if your provider had the data breach and it was your information that had been compromised? Would you want to go back to that provider, or would you start finding a different provider to go to? So as you kind of consider those questions, think of a security risk analysis or an SRA as preventative maintenance, almost like a multi-point inspection on a car. You know, you go in for your oil change, they do your oil change, they check your cabin air filters, brakes, all of those different things. They're looking at different aspects that make your vehicle safe to run, safe to drive, safe to be on the road. An SRA is very similar in that regard, where we examine pieces of the organization from various points of view and various aspects. From there, that is kind of where it plays into preventing cyber incidents from happening to your organization and ultimately data breaches from occurring. We want to spot those problems before they become problems. And an SRA is a key way to help us do that. Now, when we look at conducting an SRA, there's kind of three key areas we need to consider according to the HIPAA security rule. That's administrative, physical, and technical. So we're going to dive into each one of these areas. So the first area, of course, is administrative safeguards. And within administrative safeguards, there's kind of 5 subcategories included in that. The first one's going to be your security management safeguards. Now, all healthcare organizations need to have a way to identify, mitigate, and really protect against any potential risk at all to their ePHI. And then from there, implement any reasonable security measures and really reduce risks and vulnerability for the organization. Second is your security personnel. It's important to have someone kind of designated as your security official. Maybe that's your compliance officer. If you're in a larger organization, maybe you have someone specifically assigned just to be your HIPAA security officer. One way or the other, that role should exist. Maybe it's someone having multiple roles on their shoulder or wearing multiple hats, but someone should be in charge of your HIPAA security processes, procedures, things like that. The third is your information access management. Now, your compliance officer, or again, kind of someone that's assigned to that role, is the person that will make sure that your policies and procedures are being assessed, that people are given role-based access to ePHI. So we're not, kind of giving access to everyone. The part of the policy that kind of really plays into information access management is made to ensure you have a proper procedure in place to make sure only those authorized individuals or the people who, based on their role, need access to ePHI have that access. And then, of course, an important part of that is maintaining who has that access. So that helps you stay compliant as well with the HIPAA privacy rule to limit your uses and disclosures of PHI, or what we know in the industry as following the minimum necessary rule. The fourth piece is workforce training and management. Now, your compliance officer, again, security officer, whomever is kind of in charge of your HIPAA security, should supervise your workforce members that are working with ePHI. Now, to clarify, this does not mean standing over every employee's shoulder, watching their every move. It's more having a way to audit their actions. What are they accessing when it comes to ePHI? Is there unauthorized access happening to PHI? From there, providing training, making sure that all of your workforce members know what the policy and procedure is around patient information access, and making sure that there are appropriate sanctions or responses, discipline, if you will, for those who violate those policies and procedures. Now, a review of your workforce and who has access to what, and even your training and policies and procedures should be reviewed typically at least annually. Ideally, it would be reviewed anytime an incident occurs with PHI. So whether that's a violation, a breach of information, things like that. We want to make sure that we're keeping on top of these things so that we're addressing the problem as quickly as possible, but also as efficiently as possible. And finally, evaluation. It's important to really evaluate and have your compliance officer or HIPAA security officer perform, again, that periodic review of the program, of your policies and procedures, to make sure you always remain in compliance with the HIPAA security rule requirements. All right, next up, the physical aspects. So as we look at the physical aspects of the HIPAA security rule, there's kind of 2 primary areas we look at. The first one is physical facility access and controls. Great examples of this one. Do you have a record of everyone that has a key to your office? Maybe who has alarm codes if you have an alarm system? Even something as simple as, do you have someone assigned to go through the office each night and make sure windows are locked, doors are locked, filing cabinets are locked, that there's not PHI sitting out, things like that. If you're unsure of what the answer to that question, any of those questions are, this is a perfect time to put a policy and procedure in place for that. Doesn't need to be anything overly complicated, just making sure someone has the assignment so that you can take that step to protect your information. And honestly, don't be afraid to require limits on physical access to your building, and really honing down to give access to only those who truly need that access. Now, the second part of this is going to be workstation and device security. So depending on your office setup, it may make sense to specify specific computers or other electronic devices that can be used to access ePHI. That way, you limit which machines could potentially be mishandled. But in addition, that allows you to keep a record of the different parts of transferring, removing, disposing, reusing of electronic media. So it's important, and this is a key part of an SRA, is keeping a list of all of that electronic media. Anything that you have that could store, maintain, transmit ePHI. So anything from desktops to laptops, iPads or other tablets, even phones, if you have scanners that have saving capabilities in them, even your scanners, down to portable hard drives, CDs, anything of that nature. We want to make sure that we know exactly how many of each item we have, who has it, whether it's being used, whether it's being stored, or whether that's even been destroyed. Our final area, the third area of the HIPAA security rule, is our technical safeguards. And there's 4 primary areas to follow when it comes to technical safeguards. The first is access control. And this is kind of similar to the information access we talked about in administrative control. But this refers specifically to implementing technical policies and procedures that authorize, again, kind of only certain personnel to access your ePHI. A great example of how this policy would play out is what was not done at Jackson Health System during their 2 data breaches where inside employees were stealing patient information. Having an access control policy would have prevented something like that from happening in the first place, because we wouldn't be giving authorization necessarily to those employees. The second part of this is audit controls. So think of your audit controls as kind of the practical application of the access controls. This is making sure we take the time to install hardware, software, other mechanisms to really record and examine user activities in any of your systems that access or even contain ePHI. So your audit controls, having those in place, are going to help you avoid incidents where employees potentially steal ePHI, or ePHI is misutilized by maybe a vendor if you have someone that helps with your release of information. Something to consider there. The third is integrity controls. Now, if you logged into your EMR system one day and suddenly your ePHI was changed or even completely gone, what would you do? Having integrity controls addresses those very type of scenarios and really many more. It's making sure that you have the necessary policies and procedures in place to make sure your ePHI is not altered or destroyed. And that's a critical piece, again, and that you kind of can almost think of that as the magnifying piece of an access control policy, making sure that the number of people that even have the authorization to alter or destroy ePHI is a very, very limited set of people. Because if something like that happened to your ePHI, that could potentially be disastrous. Now, that doesn't necessarily mean locking your data down so much that absolutely no one can alter ePHI, because that may also have disastrous impacts. But we want to have those controls, and you can kind of figure out what makes the most sense for your organization. But having those integrity controls basically means you know exactly who has the ability to alter or modify PHI so that you know exactly where that could have done and you know exactly who to go to if you have concerns. Now, the final piece of the technical side of the HIPAA security rule is transmission security. In the digital age that we live in, electronic transfer of information is just becoming more and more prevalent. Make sure you take the time to ensure you have the appropriate safeguards in place. Think of them as guardrails to make sure your data is not going off the road of where it needs to go. So things like making sure that if you need to, if a part of your business process requires you to send ePHI through email, that you're taking the appropriate precautions to ensure encryption and other necessary mechanisms in place so that if that email gets intercepted by someone who shouldn't have access to it, that they can't get that data. And the same can even be said for things like digital faxing or even text messaging. So the overall idea here is to remember that your data, especially in rest or in transit, needs to be encrypted. All right. We made it through that first little bit here. So as we kind of start on the downhill side of the webinar today, let's talk about some best practices to pair with your SRA. So we're going to look at 6 really easy ways to bolster your cybersecurity program, which will ultimately strengthen your annual security risk analysis. So we'll kind of split them up into 2 sections of 3. The first of which is enabling multi-factor authentication. This is an easy way. Most programs nowadays have multi-factor authentication built into them. This would be a great thing to install if you're not using it already for your email, your EMR system, or any other hardware or software that can store ePHR or ePHI, excuse me. And there's a variety of different apps out there or even devices that you can use. Programs like Google and Microsoft already have multi-factor authentication built into them. They even have their own authenticator apps that will either text you a one-time code that's that, again, that extra layer of security, or even send you to an authenticator app to enter a revolving code. The next is another simple one, just training your staff on things like phishing and vishing, the potential for ransomware, cyber attacks, any of those things. Like we kind of mentioned in the beginning, we've all received those phishing and scam emails and the horrible vishing voice calls that plague your phone. But some of these instances are pretty blatant. You look at them and you go, this is definitely not legitimate. But some, and more nowadays, are getting so sophisticated that you can easily be fooled if you're not paying careful attention. Some of the common things we're looking for, especially in phishing emails, are incorrect grammar or misspellings, and even hovering over the email address to see what the domain is. Typically, a phishing email does not come from a legitimate domain. It usually comes from a mainstream email domain like Gmail, Outlook, Yahoo. If Hotmail even exists anymore, I'm sure Hotmail would be in there too. But you get what I mean by that. Just making sure that we're checking these things thoroughly. One of the best practices I found is if the email seems legit, the best thing to do, if you have any suspicion whatsoever, you know, you've kind of gone through your due diligence, checking the email address, things like that, is reach out to the person who sent it in a separate email and just confirm that they sent it. That is the best prevention you can have because no one is going to fault you for double checking in that regard. The third one is conducting phishing simulations. There's vendors out there who can provide kind of the framework for this that will actually send test phishing emails out to your staff. That will also let you get some statistics on that, you know, who opened it, who clicked on the link, who did any of these things. And then that can kind of point you in the right direction for how you may need to retrain or maybe some areas that need additional additional exploration, we'll say, into helping your employees spot those type of risks. Now, the final three we look at are kind of more on the technical side of best practices to pair with your SRA. First, securing your mobile devices. I mean, it's no surprise in our world today, disconnecting from our devices and from technology and work is such a rarity. We're checking emails, chats, other work items while we're out of the office, traveling for work, or even at home for the night. So it's really important that you and all of your workforce are utilizing their personal devices if you've authorized them to do so. And if they are, making sure that you have the appropriate security protocols on those devices. If you are having individuals or allowing individuals to use their own devices and you don't currently have a bring your own devices policy, I would strongly recommend creating a BYOD policy. That way, everyone knows exactly what the expectation is. Everyone knows what the security procedures are if something were to happen to that device. And most importantly, making sure we protect that information that could be on that device and securing it. The next part I want to talk about is remote access. So, especially in today's economy, most organizations are really buttoning down on their workforce. They're running leaner. They're, putting a little bit more on other employees' shoulders and trying to, stay financially stable and things like that. That's just how life goes sometimes. With this kind of more of a lean operation and running that organizations are going for today, there is the possibility, and maybe more so now than before, that employees need to take work home with them to get ready for the next day. If that sounds like your organization, I'd recommend making sure you establish some type of remote access method for those individuals who have a legitimate business need to take work home with them. That can look like establishing a VPN. That could be a remote way into the computer system. Maybe they remote login, things like that, just so we make sure that we protect that data from any vulnerabilities that could prevail against a home internet connection rather than a secured encrypted business data connection. The last part is conducting regular vulnerability scans and patch updates. Now, today's bad actors, they continue to get more and more clever in their attempts to gain access to our ePHI. So regularly making sure your computers have the updates and that scans are conducted to make sure you know about any bugs or things like that that are going on is so important. And you'll see a lot of this with any computer software, Windows, Mac, Linux, whatever the case may be, whatever you're using in your organization. There's bug fixes that go out. There's all kinds of different things that these organizations release to help keep your software secure and prevent vulnerabilities from being attacked. So updating the software and keeping up with the bug fixes and things like that really are a very important part of your cybersecurity best practices. All right. Now we've kind of talked about what an SRA is, why it's important. Let's talk about what an SRA includes. So there's 9 specific steps that a healthcare organization is recommended to follow based on the security rule. So we're going to dive into each one of those 9 steps. You can also find these 9 steps on hhs.gov in the HIPAA for Professionals section. But we'll go through each one of them right now and just kind of give you a highlight on what's important to know about these different segments. First one is determining the scope of your SRA. That really helps you determine the potential risks and vulnerabilities to things like confidentiality, availability and integrity of your ePHI. That includes creating anything that your ePHI can receive or how it can be received, how it's maintained, how it's transmitted. Now, when we look at determining the scope, it's important that we include all areas of ePHI. similar to like what I talked about in the beginning, looking at things like computers, hard drives, floppy disks. If anyone has a drive that still takes a floppy disk, I'd love to know you. For those of you that don't know what floppy disks are or are not old enough to know what those are, we'll give you a pass on that one. CDs, DVDs, smart cards, we get the picture there. Lots of different methods, and you really need to think through where ePHI is and if there is ePHI on any of these different storage mediums. From there, we also want to kind of look at the little bit bigger picture. If you're in a little bit larger organization, that could be not only looking at computers, but perhaps a complex network. Maybe you've got on-site servers or off-site servers. Regardless, we want to make sure that we know any device, system, anything that is going to create, receive, maintain, or transmit ePHI and have a log of those. The second step is your data collection. So this is kind of the knowing where this information is stored as you create this list. So you want to know where it's being captured, where all this data is being captured. The OCR specifically recommends that you review past and existing projects, perform interviews with employees, review your documentation, and any other professional data gathering techniques that you want to apply. We want to make sure all of these different areas are explored because it's so easy for us to forget about some data hiding somewhere unless we kind of look at it from these various vantage points. Plus, once you have this all documented, you can just review it again the next year for your SRA to say, yep, this is still somewhere we're storing this, or nope, we're not doing this anymore, and update your SRA. It makes it a much more efficient process if you already know where to look and just have to kind of re-examine if there's any new places. The third step is the identification and documentation of potential threats and vulnerabilities. So this one is can be a little bit intense, but you just have to think through it a little bit. So we want, and really the way we want to go about this is thinking of any threats and documenting them. Just anything reasonably anticipated, or even things that are actual threats to your ePHI. Now, depending on the size of your organization, that can get a little unique. So kind of think of your organization like a unicorn, like the one you see on your screen right now. Your business is going to be unique from any other business out there. And some vulnerabilities may be unique to you. Some may not be something you need to worry about. Just give a careful thought for how your business operates and kind of identify what threats and vulnerabilities would impact your organization specifically. There's lots of good guidance out there that will give you general information, and that's a great place to start to help you identify those more specific areas. So if you're not entirely sure what some of those vulnerabilities are, talk to your colleagues, talk to other compliance officers, practice managers, other physicians, talk to the people around you. Someone will always have something to contribute that will help you better understand your organization or the industry as a whole and help you get those ideas. Even compliance experts are a great additional resource to reach out to. Now, as we think about this, consider what would happen if something triggered one of your vulnerabilities or if it got exploited. Would it create a risk of inappropriate access or disclosure of your PHI? As you kind of think of it from that perspective, if you go, yep, it would, great, document it. Document it and follow it before it becomes a problem. Now, the next one is to assess your current security measures. So we want to assess those, and on top of that, we want to make sure we document them. We want to know what we have in place. We want to know if it's working, if it's being used properly, making sure we're following the HIPAA security rule. In larger organizations, you may have specific kind of departments that may manage some of this. So most cases, we typically see this as like an IT vendor or an IT company. just kind of know what your security measures are and make sure that those are documented so you know what is protecting your organization. The fifth step is determining the likelihood of the threat occurring. So we need to really understand the probability and potential risks to our ePHI. Easiest way to do this is just make a list of any of those potential threats. The results of writing this list really help you kind of guide and determine what threats are going to require protection because they're reasonably anticipated, is how the OCR would put it. The result of your SRA really should help create this document of knowing what your potential threats are. For example, identifying of threats. One potential threat could be that someone gets a job with USPS as a mail carrier, and maybe they covertly steal your PHI. Maybe they steal some ePHI. Maybe it's on a CD or a thumb drive or something like that. Now, the odds of this happening are pretty unlikely, but it is a potential threat that could be a problem. If we compare that to something like an employee getting a phishing email and clicking the links in that email and exposing our system, the odds are typically a little bit higher that that type of scenario would occur. So you just kind of look at your various threats and determine the likeliness of that threat to actually occur. The next is determining the impact that that threat would have. So make sure that you take the time to really assess what the impact would be if a certain scenario occurred. You can use anything you want to do this. You can use statistical data, observational data, a mix of both, whatever is going to help you understand your data. Now, the end result of this piece is going to be some additional documentation that really helps you identify the impacts of your data and what could impact your ePHI. Step 7 is determine the level of risk. Great way to illustrate this is just using a high, moderate, and low impact scale, whether it falls in one of those categories for a likelihood or an impact. For example, a healthcare organization has a high likelihood of receiving phishing emails. However, if your staff is appropriately trained, knows how to spot those phishing emails, and you have procedures in place that everyone follows to keep your ePHI safe, the impact to your organization when a phishing email comes in would be considered low because your team knows what to do, they know how to handle it, and they know how to protect your organization. So the final result of this, again, is going to be documentation that really helps you see where your risks line up and how you can mitigate those. We're almost there. Step 8, finalize your documentation. The HIPAA security rule does require you to document your security risk analysis. However, the format you do that is up to you. Just make sure it includes everything you need to protect your organization. If there's one rule of compliance that I would state to anybody, it's document. If it's not documented, it didn't happen. Conducting your SRA and having that documentation is absolutely crucial. So as we look here to step 9, let's shampoo, rinse, and repeat, right? So the final piece of conducting a good SRA is reviewing it and repeating it. We want to make sure our SRA is kind of an ongoing exercise. Although the requirement is once a year, this is a great exercise to run even more frequently than that if you can make it happen, because that keeps you on top of any potential threats coming into your organization and helps you to not fall prey to them. If you do happen to experience a security incident involving your ePHI, don't forget to review your SRA to determine where you fell short, because your SRA should help you prevent those things. And honestly, mistakes are not a bad thing. They are a part of the learning process, and they are what is going to show you where your SRA fell short or where your policies and procedures are falling short, and then allowing you to kind of bolster them up and make sure that you're more prepared in the future. Now, as we kind of come to the conclusion and wrap up of the webinar, I want to address a couple common misconceptions and frequently asked questions that I've gotten over the years regarding the SRA. And hopefully, if you have questions, some of these will be included, and then we'll start getting to some of the other questions that we have in the queue. The first misconception is that the SRA is just a checklist. So an SRA is a checklist like an apple pie is to a recipe. The list is an essential piece to have to know what direction you need to follow and what you need to apply. But without properly following the steps and having the right tools and resources, it doesn't do much good, or your apple pie is not going to turn out. The second is that the SRA is only required for large organizations like hospitals, medical centers, large provider groups. Incorrect. Even a practice with only one provider by themselves with no employees, or a billing company with only one owner, regardless, the SRA is a requirement for any organization that's required to follow the HIPAA security rule. In fact, nowadays, smaller groups tend to be targeted more frequently than larger groups because bad actors understand that smaller groups don't have nearly the same resources as large groups to protect patient data. So if you're a smaller organization, the security risk analysis is just as important, if not even more so, due to limit on resources. The third misconception is that if you don't see patients, you don't need to conduct an SRA. That's also incorrect. If you do anything with ePHI, from creating it to maintaining it, transmitting it, or storing it, you are required to complete an annual SRA according to the HIPAA security rule. Now, the next one, do I need an SRA if I did one last year? Great question. Yes, the SRA is not a one and done type of assessment. It's meant to be conducted at least annually. Because threats and vulnerability change, and they change so frequently, if you're not conducting an SRA at least annually, your organization could be open to any number of new and devious methods that bad actors have come up with in the last year. One of the things that Rahul Gaitan, who's HHS's Cybersecurity Operations Cyber Threat Intelligence Branch Chief, what a title for a business card, during a NIST webinar last year, he said this, and this has resonated for me in a very powerful way. He says, AI has the ability to really hypercharge cyber attacks. As an organization, we've been asked a lot, what is AI going to do for cyber threats? How's it going to impact them? And in response, he said, AI is basically giving hackers a case of Red Bull and a bunch of experts for free. So when you think of your SRA, that is what your SRA is up against. You're up against a group of hackers with Red Bull and a bunch of free experts. So this is really an imperative thing to have in your organization. Now, one of the final questions that we'll go through is, doesn't my IT team or my IT vendor do my SRA for me? Well, the answer to this is yes and no. Most of the time we find that either an IT vendor or an IT department focuses more on the technology side of things, but completing an SRA also includes the evaluation of things like policies, procedures, training, and other important compliance topics. All of those things rolled together create a thorough SRA and play an important role in reducing your organization's risk. Well, congratulations, everyone. You've made it through another compliance webinar. I know they can be challenging to sit through sometimes, but I hope everyone was able to learn something you didn't know today or gain some new insight you didn't have before. So now let's go ahead and open it up for any questions. Josie, have we had any questions come through on the webinar today?
Well, I can actually answer that for you, Jake.
Oh, perfect. Thanks, Nicole.
You're good. So we did have a few, one of which you already answered about the size of the organization and whether or not you have to do an SRA. Another question that I think is important is, does it apply to all specialties, or does it matter what type of services you provide to patients?
Great question. So it applies, the SRA applies to all specialties. So anything from a primary care doctor to a surgeon to medical spas, it spans the entire realm of healthcare. Even things like billing, consulting, anything, if you're touching ePHI of any kind, transmitting it, any of those things, the SRA is a requirement for you. Great question.
Good question. Another question that we had, which I already answered in the chat, but somebody had asked if the individual offenders in those cases that you presented were held criminally responsible. And I did answer that. I don't know if you have insight into that, but at least in Baycare and Jackson, OCR had not identified the individuals. And as of now, no criminal charges have been handed out. That doesn't mean they won't be, but they focused on the system and their faults. And so I don't know if you have more you want to highlight on that in your research.
Yep, exactly right. So the OCR has really prosecuted against the healthcare system. That's exactly right. The individuals themselves would be prosecuted by the health organization. The only one I'm aware of that is least publicly released any information about going after those employees is Jackson Healthcare. I do know that they are looking at legal implications against the most recent employee who stole those 2,500 patient charts.
And then at least the last one in the Q&A for now is what um, type of deliverables or what kind of information will we provide after the webinar as far as your PowerPoint, all that fun stuff.
Great question. So once the webinar's wrapped up, you'll get a follow-up email to the email you used to register for today's webinar. In that email is going to be a list of kind of helpful, frequently asked questions, but also I've included links to the NIST free version of the security risk assessment and some other helpful links to the Department of Health and Human Services regarding the HIPAA security rule and some best practices to follow for conducting an SRA. And of course, you're always welcome to reach back out to us if you have specific questions. We are here to help, and I'm certainly happy to help answer anyone's questions about the SRA.
Okay, perfect. That was all that was in the Q&A for now.
Terrific. Okay, well, we've got about 2 minutes left, so we'll hang tight if anyone else has any other questions they want to add in. But I just want to say before we wrap up, thank you for attending today's webinar. Here's my contact information. Love to connect on LinkedIn. If you do have any other questions about conducting an SRA, please don't hesitate to reach out. I'm more than happy to answer questions and help guide you along this wonderful world of compliance. Oh, great point from one of my colleagues. If you are a member of the AMBA or even HCCA, please make sure that you submit certificates for your CEU credits. If you're a part of AMBA, we will send you that certificate. If you're a part of HCCA or looking for those credits, a copy of the PowerPoint will be sent out as well, and you can utilize that for your submission for credit for today's webinar. Perfect. Well, that is our time. Thank you everyone so much for your participation today. And we hope to see you again at another HCP webinar in the future. Have a great day.